So let's talk about anatomy. The anatomy of the veins is really broken up into two main parts, and that's the deep veins and the superficial veins. The deep veins, think of that as the highway going to the heart. That's a straight line from the deep system to the heart. Think of that also as maybe your interstate. That's your I-40. 80–90% of the blood flow is going up to the heart via the deep veins. And therefore, if there's a blood clot in the deep veins, that's a high risk for going to the heart and then the lungs causing a DVT. The superficial veins is kind of your byways. Those are your rural roads. Those are the connecting routes. Those superficial veins really are draining the skin, the adipose tissue, the fat. Those are all joining together, getting into the deep veins. So about 10 to 15% of the blood flow is going through the superficial veins. And that's a very rich network of veins there. And the perforating veins sometimes are these communications that can happen directly between the two. So we have here an image of the greater saphenous vein. And as the name implies, this is the longest vein in your body. It starts at the inner ankle of the leg and runs up the inner leg all the way up to the groin, and then dives deep to join the femoral vein in the groin. So it's a very, very long superficial vein. It's deep to the skin, it's in the fascia and in the muscle, but it's a very, very long vein with multiple valves that go up in sequence. That is also one of the most common veins to be treated for venous reflux disease because of its size. The small saphenous vein runs on the back side of the leg. It starts at the lateral or outside ankle and runs behind the calf and empties into the deep vein behind the calf. And it's the second most common vein to be treated for venous reflux disease. So in terms of circulation, you know, the word circulation really to complete a circuit or a revolution, circulation starts at the heart and allows blood flow to get down to the feet. It's a pretty easy system for a couple reasons. First of all, your heart is constantly beating, whether you're awake or asleep, hopefully, 60, 70, 80 times a minute, continuously. You have a blood pressure, 120/70, and you have gravity pulling that blood flow down. So the arteries getting the blood flow down typically are not the problem. The problem is the opposite, getting the blood flow back up. So think of the salmon swimming upstream. It's got to go up against gravity. And there's no central pump in your toes pushing the blood flow up. So the way that this works is this is really a musculovenous contraction, meaning anytime that the muscles contract in the legs, they compress these very superficial, these very thin-walled veins. By compressing the veins, it opens up a series of one-way valves, allowing blood flow to go up, but when gravity tries to bring the blood flow down, the valve should shut. And so this is a main reason why patients who spend a lot of time during their profession, either standing or sitting for hours and hours at a time, those valves are under constant pressure for 8, 10, 12 hours a day. Those valves can stop working and you get poor circulation, meaning the arteries are filling the veins, the arteries are filling the legs, but the veins are not efficiently getting the blood flow back up. So you get this pump mechanism going down without emptying, and you get more swelling, heaviness, and aching over time. So this is the musculovenous pump, and this is a image of contraction, allowing the blood flow to go upwards, and then on relaxation, the valves shut to prevent blood flow from going backwards. And so you can see nice upward flow on contraction, but the valves function to prevent the backward flow. So this is a normal functioning vein. And so again, we're looking at the valves functioning normally versus reflux or reverse flow in the veins, and that is shown here in this depicted cartoon here. You've got contraction allowing blood flow to go up, but on relaxation the valves don't meet and you have blood flow going down. So again, the arteries fill the legs, but the veins are not efficiently emptying the legs, leading to swelling, aching, heaviness, fatigue, varicosities, skin changes, and so on. So venous malfunction can be broken up into reflux, which we've talked about, as well as obstruction, which is a blood clot. And we also briefly touched about obstruction, and this is something that we have to rule out in terms of the causes of swelling. And so we want to make sure that during the workup we can exclude a blockage, blood clot, or any other type of obstruction as well. So next we're going to go into to treatment, and we're going to talk about both conservative and minimally invasive procedures, and I'm going to have my partner, Dr. Rudd, talk about this. Thank you.